This is not something that I do easily, but I'm getting better. I want to thank you for being here and listening to me. I promised I was going to make this fun. Over the years, I developed some severe leg problems, obviously. And so it became a battle about which was going to come first and how was I going to continue. And I didn't have any problem getting my knees replaced. That was a period of 10 years in between doing the operations. And it was basically a good experience at a wonderful hospital. I have nothing but good things to say about healthcare providers, and particularly nurses. A little less about doctors. But anyway, the knees are fine, the knees are great, but the feet fell apart. And they were the course of the problem all along, but nobody knew it at that time. So I started looking for doctors to work on my feet. And my first two approaches were right in my community. And both of them, both orthopedic surgeons looked at it and said, no fixing that one. And that's they both said the same thing, no fixing that one. So I thought, well, I have to go further afield. And my family doctor, who is remarkable and worked with me personally throughout the entire time I was at the mental health clinic in our local hospital, so we care a lot about each other. And she's been wonderful. She didn't know any orthopedics outside of my community. So I went and did some research, did what I could, found a couple of names of doctors that were highly respected and were doing work on feet. The first one was not too far from home, and I went up to him and he said, oh yeah, I can fix this, this is no sweat at all. I looked at him with great amazement. Of course, a few years had passed in this process. And so I thought, good, I've waited long enough. They've got something, they know what they can do with this. And he said, the operation's no sweat at all, but you'll have to go home and you can't put your foot down for 3 months. I don't want you to ruin my good work. Okay, so I'll set up, I live alone, I'll set up a process whereby I can manage on my own. I have severe arthritis in my hands and my wrists. I can't manage a wheelchair. I can't use crutches. I can't use an ordinary pickup walker. I have a walker, but it's a rolling walker, and I manage with that. But trying to find healthcare providers that would be set in place and organized so when I went home, because it was only overnight surgery, it wasn't extensive, but they insisted that I couldn't make arrangements until the surgery was done. I don't know about you, but if you're going home to a house where you can't get to the toilet and no arrangements have been made, that's a no-go. I can't do that. Yes, I have family. Yes, I have friends, but that's not where I wanted to be. I don't want them helping me into the toilet. My ultimate goal was that even my family doctor tried to talk to this agency that was to provide the care. No, they do not talk to you until the surgery's done. This was going to be overnight. Knowing my history with anesthetics, there was no way I was going to be able to talk the next day, let alone discuss what care I was going to need. I needed to do that beforehand. So no surgery. The orthopedic surgeon wasn't the least bit interested in talking about it. It wasn't his business. So no surgery. In the meantime, I had this other referral out there somewhere which I'd completely forgotten about. My family doctor had completely forgotten about it. I put it on the back burner and said, I'm not going anywhere for any time soon, and I'll live with this. I'm still living with this. 7.5 years later, I told Change Foundation it was 10 years, but it wasn't 10. When I looked at it, it was only 7.5 years. I'm a very patient person. I got a call out of the wild. Absolutely didn't know anything about it. It was this doctor, secretary wanting to set up an appointment. I said, what appointment? And they had to explain to me what they were talking about. I was overjoyed, but a little bit puzzled. 7.5 years for a referral? Finally, after one cancellation on his part, I finally got in to see him. Yes, no problem. And no, they didn't understand about they could do the surgery. He thought it definitely had to be done. And it would work just fine. And I wouldn't be going home right away. They would take me into a rehab facility because there was no way they were sending me home until they figured out how to maneuver me and how to get me mobile. That was 2.5 years ago. And I'm still waiting for the call for the surgery. In the meantime, when I started this, I was going on 65. I'm now 75. And I'm saying to myself, I'm not going to do this. I don't react well to anesthetic. I'm an old girl. It just doesn't feel right. And if I spend 3 months in a wheelchair, what's the chances I'm ever going to get up and walk again? I can't sometimes get out of bed in the morning without a great deal of creaking. So I haven't told them. I've called them 3 times and left messages and said, am I even on the list? And no one has ever gotten back to me. I actually was in the hospital one day, and I went up to the office and banged on the door, nobody there. So I went down the information desk and asked them, is there ever anybody in that office? And the lady very nicely said to me she didn't think so. But the doctor was still in the hospital. Of course, I couldn't see him. So that's totally unresolved, and it just leaves me puzzled. 10 years, a lot of time that has been spent, not on my part, but on the facilities parts. And nothing was resolved, and nothing got done. And I don't think that's terribly, terribly unusual. The unusual thing is that most old people like me, most chronically ill people, aren't quite so dogged. You know, I'm determined. And if I'm going to do something, I'm going to do it. It might take a while. The other thing I wanted to comment on, I've got time for just pardon? Yeah, for just a few minutes, is another aspect of my care, and this one might be a little bit touchy, and definitely a little bit touchy. Since the time I was about 55, I had real gut problems. A lot of people, I'm sure, in this room understand what that means. And I was going around, if I had a complaint at all with my family doctor, it was, well, what am I going to do about this? It seriously interfered with my life. My social life was non-existent. I was afraid to go anywhere. I didn't trust myself to go anywhere, to do anything. And there was umpteen colonoscopies, umpteen appointments with gastroenterologists. And one gastroenterologist told me that I had lost the enzyme in my stomach and I should never eat raw vegetables again. So for the next 5 years, I didn't have a salad. You know what that feels like? But he didn't know why the enzyme wasn't there. It just wasn't. Nothing turned up in the colonoscopies, for which I was very grateful because I'd had a bowel resection in '88. And that's something you don't want to go through again. And so I was reaching the point where I was on insulin. I had diabetes. I was massive blood pressure medications and cholesterol medication. And I was barely being able to get around in my own apartment. I knew I was dying. I was on my way out. I told my daughter, I am going to go, I can't believe I'm saying this, to a naturopath. And I did. I pay for it myself. The first appointment, she said to me, after she'd spent 2.5 hours with me, 2.5 hours. Where do you ever get that? Didn't cost me any more. And she said, would you consider giving up weed? I said, giving up weed? What are you talking? Yeah, why? She said, I've got a feeling you're really celiac. I want you to give up weed. Tell me how you feel. Come back in a week. I phoned her in 3 days and said, I haven't felt this good in 17 years. It's 2 years later. I'm weed-free. I take no insulin. I'm on very little blood pressure medication. My cholesterol level is perfect. And I have the blood work of a 20-year-old. Inadvertently and totally unplanned, I lost 22 pounds, which is great. And certainly has something to do with, but I lost that 22 pounds in 3 weeks. And the only thing that changed in my life was that I had to give up weight. But the blood tests, I had to go back on it to take a blood test to confirm that I was a celiac. And I'm a raging celiac. I went right off the charts. And I'll tell you, I did go off the charts. But anyway, now I'm fine. Just don't give me anything with wheat and I can't lick an envelope. So, I have some issues with the medical profession. My family doctor is wonderful, as I said. She said to me that during her training, she had 6 hours of nutrition counseling, of nutrition training. She knew nothing about it, but she was now referring a lot of her patients to try going wheat-free. And she uses me as an example. 20 years of absolute misery that really interfered with my life, that didn't have to be. So, I want to talk to you later in the afternoon about where this all led to Panorama, and my thanks to them. I'm so glad to get an opportunity to pay back. I owe the taxpayers a lot.